In this trial, it's conducted in China. It's mainly about to test the hypothesis that whether for patients with a large infarct core volume and a low aspect score, that means have a very large area, infected area, with large vascular occlusion. These kinds of patients, whether we do thrombectomy to do the recanalization, will be better than medical management. So we conduct this trial in the Chinese population. And the result showed even the patients with large infarct core thrombectomy could benefit this kind of patients, although the hemorrhage rate is much higher than medical management, but the patients finally result will be benefited for this kind of patients. So this trial conducted in 46 centers in China, separated in 20 provinces, and last for more than 2 years. And this trial included for 456 patients are enrolled and separated one by one, and to endovascular treatment group, and the other to the medical management group. And this trial conducted held two interim analysis, and the trial stopped early after the second interim analysis showed benefit for endovascular treatment. So the DSMB stopped the trial, and during that time we had the result of 336 patients as follow-up, and additional 120 patients enrolled. After all these patients finished follow-up, we found the result, and the result showed the benefits of patient. The 19 days MRI score had a significant shift analysis to the better outcome for endovascular treatment. And although the total hemorrhage is a little bit higher, but the symptomatic hemorrhage has no difference between two groups. But we are very quite different for the population choose. We choose patients with non-contrast CT with a SPECT score between 3 to 5. And for patients also with the infarct volume for 70 to 100 milliliter, for this kind of patients, it's not very large infarct core. So the results show the benefits, and we just published the data in the New England Journal of Medicine. For the previous study conducted for small infarct core volume patients, but after the publication of 3 trials focusing on the large infarct core volume, I think we have just working on put the 3 trials together to the meta-analysis, and I hope the result will be, I think it's positive, because all these 3 trials are positive, and that will affect the guideline. I think in the future, the guideline will be changed, because even though the patients with a little bit higher infarct volume, they can also suggested to do thrombectomy, and this kind of patients also could benefit from thrombectomy. This study is quite different from previous studies because it conducted in China, and also the technique used in this trial is quite different from other trials, because we allowed to use permanent stenting and also angioplasty, because we have more ICAS. And also in Chinese population, I think there's very low rate of intra-arterial thrombolysis before the thrombectomy, and that will be not benefit for the medical management group. So I think there are some limitations for this study. Still needed to further trials to prove the results.